A couple quick notes. I want to thank everybody for attending today. I want to thank NTC Workforce Development and Training Center for helping us not only support this event here in our home campus in Medford, but also streaming throughout the other 5 campuses within the NTC system. I also want to welcome everybody that's joining us online and everyone that is joining us post-event on our YouTube channel at TCHDWI, if you're going to search us up on YouTube. From our funding partner.
Hello, my name is Guji Madakwe. I am the Deputy Director of the Advancing a Healthier Wisconsin Endowment, and I'm honored to join you at this important learning event focused on building capacity to prevent suicide in Wisconsin communities. The Advancing a Healthier Wisconsin Endowment, or AHW, is Wisconsin's largest health improvement philanthropy and the only health philanthropy in the nation stewarding public funds from within a private medical school, that school being the Medical College of Wisconsin. AHW was established by MCW as the result of a generous financial gift made by the Blue Cross and Blue Shield United of Wisconsin to the people of Wisconsin, giving AHW the extraordinary responsibility to steward this financial gift on behalf of Wisconsin residents. We do that by investing in promising biomedical research, supporting community health initiatives, and building the health workforce needed by Wisconsin. Since 2004, AHW has invested in $337 million in 600 projects. The Learning and Event Support Grant we provided to the Taylor County Health Department for this event is just one of many funding opportunities AHW offers to community-based health organizations and other nonprofits, as well as MCW researchers to propel promising work and ideas aimed at improving health and advancing health equity in Wisconsin. I invite you to visit ahwendowment.org to learn more about opportunities to collaborate on our shared vision of a healthier Wisconsin. Thank you and enjoy this day of learning and networking. I have no doubt you will receive both information and inspiration that will benefit the important work you all do.
So just a quick note, all of today's sessions include not only a summary handout that you'll be available on this drive. So I'll leave this up for a second, those in the room. It is the same drive all day. So every handout that I get from our presenters, any additional information that may be helpful to you, including things like research and practice, different guides for doing things within your community, those are all available on that drive. So you can either scan, you can visit this link, and we'll also be dropping it into the chat on our live sessions here virtually, as well as it is in the comment sections below. So today's presenter around our LGBTQ plus communities is Erica Steeb. I will allow her to introduce herself. I'm going to do a stop share here and turn it over to her. Erica, you can go ahead and pull up your slides.
All right. Hello, everyone. Yeah, thank you so much for having me. And then Melissa, real quick, so we're leaving the last half hour for community resources, right?
Right now, if you have material for the whole thing, we'll go with it. And then if we have things to add, we can surely go ahead and add them as well.
Okay, cool. And if we have time, we can always do Q&A too.
Perfect.
So, all right, thanks for having me. I'm Erica Steib. I use she, her pronouns. And today I'm going to be presenting on LGBTQ suicide prevention and the power of peer support. So let's get into it. So today's agenda, we're going to cover some basics of information around sexual orientation and gender identities for the LGBTQ community. We'll go over risk and protective factors for LGBTQ mental health and suicide. And then we're going to dig deeper into a protective factor of LGBT mental health, which is peer support. And in that, I will explain a little bit more about the Prism Program, which is the peer support program that I founded and that we coordinate at MHA, which really is meant to build up this one protective factor. But the goal here today is to come away with just better understanding of LGBTQ mental health needs, the services we provide, and also how you all can create protective environments for this community. So before we get into it, I just want to give a quick shout out to some other services that my organization offers. So I'm with Mental Health America of Wisconsin. We are the statewide lead in suicide prevention. We coordinate Prevent Suicide Wisconsin, which some of you may have heard of. I see some familiar names in the crowd today, so that's exciting. Yeah, just wanted to let y'all know that we do provide other direct services. Like you'll hear about Prism, but we also have the R&R House, which provides a peer-run respite and warmline for veterans. And that the respite's located in southeastern Wisconsin, but open to any Wisconsin resident who's a veteran. And then we have 2 online support groups for suicide. So we have Survivors Helping Survivors, which is for those who have lost a loved one to suicide. And we have Alternatives to Suicide groups, which are for people who are seeking out support for their own experiences with suicide, thoughts and feelings and attempts. So because these groups are online, they are open to anybody, anyone can join. So I just like to shout that out because I know people are joining from all over today, and these are free resources. And you'll be able to get information about that if you go to our website, or I dropped some flyers in that resource document that Melissa's been sharing. So check that out. So just a little brief introduction of me. So my role at MHA, I'm the Suicide Prevention Program Manager, and I'm also the founder of the Prism Program. I've been with MHA since the end of 2019, and my background is in psychology and LGBT studies, and then I went on to get my master's in public health, all at UW-Milwaukee. And so I've always been really driven, to work in mental health. I kind of stumbled into suicide prevention. I never really necessarily thought I would enter this field, but I'm really happy I did. And I really see suicide as a public health issue, and particularly for communities like the LGBTQ community, we really need a multifaceted approach to address the inequities that exist that contribute to the problem of suicide and poor mental health. So when I was in my Master's of Public Health program, I had to do a capstone project, and I really wanted to create something that could be useful for LGBTQ youth. I'm really passionate about this population because it's my community, and pretty much everyone I love in my life is queer or trans. And so, this has been a labor of love, and it's what, just drives my work. And then love to show and shout out some other folks who have built up the Prism program over the years. These are just a few pictures of our peers and our other friends from different events we've done. So would not be possible to have this resource without all these folks and more who are not pictured. Okay, so today we'll start with some basics about LGBT identities. So I know that this is a big acronym, and it seems like there's more letters getting added on all the time. And so just as a refresher, or if this is new to you, what this stands for is lesbian, gay, bisexual, transgender, queer or questioning, intersex, and people of other gender and sexual identities. And I'll talk more about these terms in a little bit. But you might also see LGBTQI, QIA, 2S is being added more. That stands for Two-Spirit, which is an Indigenous Native American understanding of gender outside of man or woman. It's, for brevity, I just like to say LGBT or LGBTQ, but it's, people are adding more letters in an effort to be more inclusive. Language is always evolving, and we'll talk more about that. But this population of people is, as of 2021, estimated to be 5.6 of the United States population. And this population, and that's probably an undercount too. This population deals with a lot of health disparities, not only in mental health, but in physical health. And when we talk about health disparities, that's a public health term that is referring to differences across communities that are unjust and unnatural. So I just like to kind of give that caveat whenever we're talking about this population, because some people think that that it's a sickness to be LGBT. People think it's a sickness to be queer or trans, and that's why they face these poor mental health outcomes. And that's not true. Disparities have to do with a group's position in society, what resources they have access to, how they're generally understood. And we'll talk more about those things today as well. So it's true that there is, there's a lot of kind of bad news for LGBT health. They face a lot of limited access to affirming and effective healthcare, discrimination in a variety of settings. And we'll talk more about that, but it's also important not to only think about the LGBT community as as these hardships that they face. This is also a community that is resilient and joyful, and despite all the hardships just throughout history, we've found a way to survive, to take care of each other. Yeah. So gender and sexuality. Gender is really asking the question, who am I? Like, what is my internal sense of being? And sexuality asks, who do I love? And we'll explore a little more. So gender versus sex. So gender is a social identity, whereas sex is what you are assigned at birth based on your anatomy. So sex is typically male, female, or intersex. And intersex refers to people who are born with characteristics of both male and female traits. So they might have a mix of both, internal and external. And gender and sex don't always match up, right? So some terms that are used to describe gender that you might have started hearing about and have some familiarity with, but the most commonly used ones are cisgender, which means you identify with the sex you were assigned at birth. Transgender means you don't identify with the gender you were assigned at birth. You are a gender that is different than the one the doctor gave you, and that's on your birth certificate. Gender queer and non-binary and gender fluid have some similarities. All of them kind of point to an experience and an identity of gender that is broader than just man or woman. So, and it's really important when we're thinking about these terms, when we hear people use them, to not make assumptions, because everyone has their own internal experience of this. So some non-binary people feel that they are like a third thing. Some people consider non-binary like a third gender, but other people don't consider it to be so categorical, if that makes sense. Some people might use the word like gender fluid or gender queer to kind of describe like how their experience of their gender fluctuates maybe in different times or different settings. So all of like these terms, they have similarities, but they're like the real meaning of them is going to be a little different from person to person. But yeah, that's kind of what that's getting at. Gender is really a spectrum, because there's all kinds of shades of gender. There's all kinds of people. Yeah, it's vast and expansive, and man and woman, it just, to sum it up, is not enough to really describe the full population. And then, yeah, there's so many more terms that could be listed here, but these are just some of the ones you're probably most likely to hear and you might be familiar with. But language is always evolving. It's important to just take, an attitude of curiosity with that. So an identity, kind of like what I've been saying, it's that internal sense of being. So like man or male, woman or female, or both, or neither, or something else entirely. And then expression is getting at like the way a person presents themselves, the way that they act or dress or speak or behave. So these are adjectives like feminine, masculine, androgynous. So androgynous being kind of like neutral. And again, there's so many other adjectives that can be used. So gender is different than sexuality. So gender, right, that internal sense of being. Sexuality is like, who do you love? Who are you attracted to? So again, like there's no one size fits all approach to these things. They're experienced differently by different people. Just because someone is a certain gender doesn't mean automatically that they're a certain sexuality. So yeah, attraction, how a person characterizes their sexual and emotional attraction to others, and sexual and romantic orientations don't always align. So some terms are heterosexual or heteroromantic, referring to like you are attracted to people who are the like opposite quote unquote gender to yourself, and only one gender. You're only attracted to one. Homosexual, also, you know, gay or lesbian are very common terms, or homoromantic, referring to you only have attraction to people who are the same gender as you. Asexual or aromantic, that refers to the lack of attraction, whether that's sexual or romantic. So you just generally don't feel attraction to other people. And then bisexual or biromantic, that means bi is just referring to two or more. So you're attracted to more than one gender, whether it's, any type of gender. And then queer is also a word that is used to describe both sexuality and gender. Again, this is an interesting one because it has been used as a slur at different points in history, but a lot of people are taking it back these days. And I think what people often like about the word queer is that it's just kind of referring to something outside of the binary, and it can be a very flexible term, and it just kind of connotates like not straight and not cisgender. But some people still do feel some people don't like the term because, again, it was used as a slur for a long time, and it is still today by some people. So again, it's just like up to interpretation, it's up to personal preference. And then it's just important to note that like sometimes these sexuality terms like they don't match up. So someone might be asexual where they really don't experience sexual attraction, but they could be heteroromantic or homoromantic. So they still feel emotional attraction and like love and like want to have those kinds of relationships with people, but they personally don't prioritize sex. And that also doesn't mean they don't have sex, but that's not like a driving force in like how they interact with partners, I guess. But again, this list could go on and on. There's so many other terms. And it's, if you ever don't know, and the thing is like, no one's expected to be an expert on all the terms. I'm not an expert on all the terms. And like, if you don't know and someone's talking to you and describing their experience, it's just important to take an attitude of curiosity and compassion. And, you can learn a lot from someone. Just know that these things aren't one size fits all. It's a spectrum. So next I will talk about LGBT mental health. So there's going to be a lot of data in these next few slides. There's a lot of this focuses on youth, but there's also going to be info about adults, and really a lot of it is applicable to both. But LGBT youth are they face higher rates of suicidal thoughts, attempts, and deaths compared to youth who aren't LGBT. This is reflected in data from Wisconsin. We have the Youth Risk Behavior Survey, which really provides a lot of helpful insight around youth mental health because it's coming straight from the source. And then the Trevor Project is one of the best sources of information on a national level, and we see these trends really reflected in both. So there's a lot of social factors that kind of play into poor mental health for LGBT youth. So LGBT youth report higher levels of depression and anxiety, social isolation, bullying, family rejection. They tend to start substance use earlier, and higher rates of suicide attempts and deaths. And it's really important to keep these things in mind because it's not hard to understand how, being bullied at school or being rejected by your family can play into poor mental health that can really drive someone to use substances to cope, or that could drive someone to suicide and self-harm. So it's really important, again, to keep these things in mind because this is an example of how social positioning and social reality really plays into mental health. So this is from Trevor Project, just kind of showing the trends in LGBT youth mental health and suicide risks from 2020 to 2022. So this is just showing that there is a slight increase So the top one is anxiety symptoms have been increasing since 2020. The yellow's showing symptoms of depression. Really interesting in 2022 that it spiked so much. I think a lot of that has to do with being at home so much during the height of the pandemic, not being able to have their social support at school with their friends. That was really hard on LGBT youth who might have been stuck at home with family who wasn't accepting. And then, yeah, the purple is looking at suicide, considering suicide, and then the green is showing at attempt, which tends to kind of flatline. But yeah, so these trends are interesting to keep in mind, and we can think about two other things that have been happening in these last couple of years with the pandemic, losing that social support at school, also some of these political attacks on this community that we'll also talk about in a little bit. So yeah, something to keep in mind. And then this is showing data from the Wisconsin Youth Risk Behavior Survey and comparing it to the national level. So blue is for cisgender and orange is for transgender youth. And we do see, again, that like our Wisconsin trends kind of mirror the national trends in that, yeah, transgender youth are, trans and non-binary youth are considering and attempting suicide more than cisgender youth. And then the Trevor Project also did a study recently, really digging down into multiracial LGBTQ youth as well to see, and they found that multiracial LGBTQ youth report even higher rates of suicidal ideation attempt compared to monoracial LGBTQ youth. And 63% of multiracial LGBT youth report self-harm compared to 56% of monoracial LGBTQ youth. And so what this kind of points to, again, is how like intersecting identities and experiences can also contribute to different mental health outcomes. So multiracial LGBTQ youth are probably also dealing with discrimination or just other types of racism in addition to experiencing this kind of social rejection as a result of being LGBTQ. And then this slide is getting at the experience of like threat or harm on because of their identity. So 36% of LGBTQ youth report that they've been physically threatened or harmed because of their sexuality or their gender. 37% of transgender and non-binary youth especially report that they have been physically threatened or harmed because of their gender. And then this is for multiracial LGBTQ youth who had experienced threat or harm based on their identity. They report 3 times the rate of past year suicide attempts compared to multiracial LGBTQ youth who had not been threatened or harmed. So again, this is pretty intuitive, I think, right? Like when people are experiencing violence or even just the threat of violence, they don't feel as safe. They don't feel like they belong in this world. And this contributes directly to thoughts of suicide and attempts. And then discrimination as well. More LGBTQ youth who attempted suicide in the past year reported experiencing discrimination. And then on top of that, multiracial LGBTQ youth, 39% report discrimination as well based on their race and identity, compared to 47% of monoracial LGBTQ youth of color. So that's kind of referring to multiple racial identities that are intersecting compared to just being one race. So yeah, there's a lot of data. I don't want to read all the words. I know this can be a lot. But also pointing to some other social determinants of health, housing and food also has a direct impact on suicide. So among multiracial LGBTQ youth, 31% experienced homelessness. They had been kicked out or ran away, compared to 23% of monoracial LGBTQ youth who, And this is, again, higher among trans and non-binary youth. And 27% of LGBTQ youth who experienced homelessness in the last year reported a suicide attempt in the last year, compared to 13% who had secure housing. And then food insecurity is also higher among multiracial LGBTQ youth, and even higher still among multiracial, trans, and non-binary youth. So all this is to say that, I mean, I think anyone can understand why being kicked out by your family would contribute to thoughts of suicide or just homelessness in general, right? That's incredibly hard for anybody, but especially youth who are particularly vulnerable. So again, when we're thinking about how we prevent suicide, you know, there's so many different variables that need to be addressed. And that's really what I'm trying to get at with these slides is that, you know, again, because of systemic exclusion, this population is not understood. This population faces violence. This population is discriminated against, and these things can also intersect with other forms of discrimination and violence based on race. And so, when we're thinking about how we can prevent suicide, we have to think about how we can be sure that people are included in society, that they have the resources that they need, and that that the violence stops. And in addition, these things have to be addressed in addition to getting folks the care and the support that they need. And then conversion therapy is still a practice that's occurring. So conversion therapy is any kind of therapy or treatment that's meant to change someone's gender or sexuality. So it does not work. There is so much evidence to demonstrate that you really can't, there is no long-lasting effect of conversion therapy and actually, you know, changing people's identities. And it actually causes a lot of harm. It can cause long-term trauma, but it is still happening, even in Wisconsin. It's not as popular as it used to be, but it does still exist. And so youth who have been through conversion therapy do report higher attempts of suicide, and even just being threatened with conversion therapy, like by their parents, can contribute to this too. Yeah, 2 out of 3 multiracial LGBTQ youth report a friend or family member trying to change their gender identity or sexual orientation. And that's slightly higher than monoracial LGBTQ youth. So yeah, that's also interesting. Like, these are just people in their lives who are trying to change them. And even that can have a harmful effect. So again, yeah, these kind of practices need to stop. As well, we are seeing in self-report from LGBTQ youth that these broader conversations about their identities and these policy attacks on their rights also has a direct effect on their mental health, and they're actively worried about it. You know, these youth are constantly under threat of losing their access to things like healthcare, to losing affirming spaces at school, to having, you know, the bathrooms that they use be policed. And this is understandably a huge source of anxiety for these youth, especially trans and non-binary youth who have to worry about this the most. Over 90% of trans and non-binary youth are worried about accessing healthcare and accessing public bathrooms. And so, yeah, any of this stuff, whether it's happening directly to them or whether it's happening in other places and they're hearing about it, it does have an effect on them. And understandably so, right? Like, if, again, society is telling you at every turn that you don't belong, that you can't access these very basic things, bathrooms, healthcare, affirming spaces, when you're constantly being told that, of course, that contributes to anxiety and depression. And of course, that can drive someone to suicide and to feeling like they don't belong in this world. So all of these things matter. And youth are paying attention, and it makes a big difference. And so what also makes a big difference is outward support and, you know, fighting back against these things and fighting for inclusion. Trevor Project also asks youth about, like, you know, their desire for mental health care. And what it shows year in year after they do this report is that most LGBTQ youth do want mental health care. Like, they want support. They know they're not doing well. But oftentimes they can't receive it. So 60% wanted care but could not receive it in the last year. And so there's a lot of reasons for that youth are reporting. So they say like the top 10 reasons are like being afraid of discussing their mental health concerns, being concerned with getting parent or caregiver consent. They might just generally feel distrustful and feel like they're not going to be taken seriously. Affordability is a concern. Fear of the mental health care not helping, fear of being outed, fear of being misunderstood. With virtual care, there might be concerns with getting that care at home. And then lack of transportation, and again, lack of parent caregiver permission. So these things are all like really real barriers that just prevent them from reaching out in the first place. And all this points to like, you know, we really need more accessible mental health resources for this population. And they need to, it's really important that they're also relevant for them, that they understand their identities and that they're prepared to care for them, that they're not going to go to that provider and be misunderstood, or go to that provider and experience discrimination or prejudice. Like this is a real fear that prevents them from reaching out and getting the care that they need. And then a little bit on adults. So yeah, similarly, we do see these similar rates, higher disproportionate rates of poor mental health outcomes in LGBT adults too. They report higher rates of depression and anxiety. We can see this from other surveys like behavioral risk factor survey. There's a lot of good national and local studies on transgender health and needs assessments. LGBT adults also face discrimination in the job, in housing, and often have lower rates of insurance coverage for preventive services and lower healthcare utilization overall. So, right, there's often this like discrimination in employment. So that can, again, lead to jobs that might not have insurance or might not have very good insurance. And that's harder then for them to get the care that they need. And then there's generally that fear again, like similarly to youth, they're afraid if they go to the doctor or the provider, they're not going to be understood and they're just going to have, you know, more discrimination or, yeah, they're just not going to feel safe going to them. So all of those things contribute. And then on the 40% of transgender individuals report attempted suicide at some point in their life. So 40% of all transgender individuals, like that is 9 times the rate of the general population. That is unacceptable. And yeah, it just again points to the effects of being a marginalized person, being someone who has been systematically misunderstood and demonized by society. And so to deal with this, yes, we need to be sure that people can get the care that they need and that it's accessible and easy and affordable. But we also really need to address these other things that are preventing them from full participation in society. And then protective factors. So protective factors refer to the things that decrease one's likelihood to think about or attempt suicide. So LGBTQ youth who feel high levels of social support from friends and family, who live in an accepting community, who have access to affirming spaces, report significantly lower rates of suicide attempts. And LGBT youth who have even one accepting adult in their life are 40% less likely to report a suicide attempt in the last year. And the Trevor Project asked youth, you know, what ways do parents or caregivers make you feel supported? And this includes things like being welcoming to LGBTQ friends or partners, talking to them respectfully about their identity, using their name and pronouns correctly, supporting their gender expression, you know, allowing them to dress and experiment and yeah, try different forms of expression. And they feel supported when their parents educate themselves about LGBT people and issues. And so, so there's a lot of ways anyone in any role can think about these protective factors and implement them in the places that they're working and living to create safer spaces for LGBT people. So there's a lot of ways you could do this, and I'll just give some examples. In normalizing, like introducing yourself with name and pronouns. So like I did that at the beginning. I said I use she, her pronouns. If pronouns are new, you know, in a nutshell, I mean, pronouns are very just basic, you know, English. Like pronouns are a stand-in for nouns, names, or phrases. So she, her, he, him, they, them. There's other pronouns that people use too, but those are probably the most common. They, them pronouns, can be used in the singular. And that is, again, just something that non-binary people might want to use, but not only non-binary people. So again, like we shouldn't assume based on the way someone looks or anything, like we just shouldn't assume how people identify. And it's very normal to do so. Like, I think like this is a learning curve for a lot of people, but when we get in the habit of sharing our own pronouns with people, then it gives them space to do so, so that they can be referred to in the way, that is accurate and that makes them feel affirmed. So that's why, like, you might see pronouns in email signatures at the start of presentations. It's just an effort to be inclusive and to just normalize it. The same way you might introduce your title, your name, like pronouns are just as valid. Other ways you can create safe spaces, I mean, listening to LGBT classmates, coworkers, peers about their experiences in those places, if they have thoughts on what could be different. Advocating for LGBT rights, especially in conversations at work or school. So like when these things come up, if you have an opportunity to educate someone, that's important. If you have any influence over a policy in a school, in a place, how can you use what influence you have to create these safer spaces, to allow for things like pride flags and things like that are symbolic gestures, but that do mean something to people and that can just instantly make them feel safer. And if you can do these things and it's free and it's easy, why wouldn't you? And some others. So some other tips would be using gender neutral language. This is more just, again, just kind of getting in the habit of these things. If you don't know someone's pronouns, or like you're like, pointing at a person over there or whatever, like trying to get in the habit of using they, them, like just, again, not assuming. It's just a habit, a shift in how we think about these things. If you do make a mistake when you're referring to someone, like if you get their gender wrong or their pronouns, just apologize. You can correct yourself and move on. And this is, again, like no one expects every person to get all these things right. That's really not how it is. But what people do want to see is that that you care and that you want to make an effort to do better. So if someone is informing you like, hey, I'm not a woman, or like, hey, I'm not a man, or like I use they, them pronouns, could you use that for me? Just really trying and putting forth a serious effort makes a big difference. And they're going to see that and they're going to feel a lot safer. Just following a person's lead. When they tell you how they identify, just believe them and go with it. Patience goes a long way with other people, with yourself. I think just having an attitude of language shifts all the time. A lot of people over the years have gotten used to saying die by suicide rather than commit. That's another example, just in a different area of how, just little changes over time can really change how people think and how we understand a thing. So, and then, practicing and seeking out educational opportunities. So there's always more to learn about LGBT people. So if you have a local LGBT center, maybe go check out their events. Forge is an organization that focuses on transgender health, and they have a big presence in Wisconsin. They do webinars all the time. Highly recommend. They're free. Just other ways you can continue to learn. And especially when it comes to like using people's names, really important that you use people's like actual chosen name, the name that they want to be known as, especially for youth. This can really reduce their feelings of depression, their suicidal thoughts and attempts. We know these things can be hard. Like, you're used to calling someone one name and then now they want to go by another. It's going to take practice and you probably will mess up. But if you make that effort and like practice in your own head, practice, in writing, practice when you're speaking to them, it makes a huge difference, because every time that people throw up their hands and say, no, I can't learn that, or like, it's too hard. Every time that happens, it's just telling these LGBT folks that that they're not worth the effort to try. So again, it's all just about new practices and about getting used to these things, and just believe people when they tell you, who they are. Okay, so now we'll talk a little bit more about peer support. So peer support is really getting at that protective factor of connectedness, and yeah, feeling like you have a community especially who understands who you are and what you've been through. So just a quick some terminology again, if this is new for anyone. Peer support is support that's person-centered, strength-based, given with the goal of personal change and healing from someone who has lived through a similar experience. So peer support applies to all kinds of things, not just LGBT things, really mental health, substance use, other health issues, like physical health issues, all kinds of stuff. A certified peer specialist is someone who is employed to provide peer support. And in Wisconsin, we have a state certification training, and it's for folks who have their own personal experience with mental health and substance use recovery, to go through that training to kind of learn how to work with others on their path to help them in setting goals and seeking out recovery. But peer specialists are not clinicians or therapists, so they don't prescribe treatment, they don't diagnose people, but they support recovery and often work in tandem with other kinds of providers, but not always. And then community, peer support is really community-based, and it encourages us to examine our lives in the context of mutual relationships and communities. So peer relationships really inspire both parties to learn and grow, rather than just one person focused on helping another. And so why peer support for LGBTQ people? So at its core, peer support is about that mutual experience, shared identity as well. And when LGBTQ people have the opportunity to be supported by other LGBTQ people, that can really just create a space for exploration. It can create a space for understanding and solidarity. And it's something that LGBTQ people really have been doing forever, throughout history, creating their own spaces, creating their own groups to meet their needs, to get healthcare, to get housing. So it's something that this population has always been doing. And then, peer support is something people in general have always been doing. But in the mental health context, it's an alternative to the medical model. It's an alternative to, other forms of care that this population can't always access or doesn't feel safe accessing. So especially when we're thinking about like all the discrimination that's still rampant in society and in the mental health field, having opportunities again to get supported by other people who get it can really be a game changer. And so LGBT people involved in peer support groups, in a variety of studies of this, they report higher social connectedness and positive identity development, like positive self-esteem. And so that's where the Prism program comes in, and I wanted to share a little bit before we wrap up about what we do. So the Prism program is a team of certified peer specialists who identify as queer and or trans and have their own personal experience with mental health struggles. And the Prism program is mostly a virtual resource, and we do have team members in different places in Wisconsin. So right now we have people working for us in Milwaukee and Madison and La Crosse, and recently Ashland County. We just hired a new team member up there, way up north there. So what Prism offers is, we're a peer support program, and we can provide mentorship and resource referral as needed to LGBTQ youth and adults in Wisconsin. So we have always really been focused on youth and trying to address that population again, because we see earlier in life these poor mental health outcomes begin. So if we can address them sooner, then we can hopefully have better outcomes for this population in the long run. But we don't turn anyone away due to age either, because we found as we've been doing this over the last 2.5 years that that there's not enough resources for adults in Wisconsin either. And so naturally, LGBT adults come to us because we're the only program of this nature. So a lot of what we're focusing on is youth and finding ways to reach them. But yeah, we turn no one away due to age. And so what we offer is a warmline. So that's a phone line that people can call or text. We have virtual support groups, and we've done in-person support groups too. Just at the moment, we don't have anything regular happening. And we also can support caregivers of LGBTQ youth. So that happens from time to time. We'll get adults, whether they're parents or relatives, or even teachers who are there for LGBTQ youth. They might reach out to us and ask for advice, ask for support. They might just need help understanding something, or they might be, trying to hook up the youth with us for some direct support. So we're happy to do that as well. Because again, when people feel like they have all that they need to support LGBTQ youth, that's going to have better outcomes for them too. So we're happy to talk to adults who are, interested in, in learning from us and in getting resources out to the kids. So how to access Prism? We have, like I said, a warmline. Numbers right here. It can be accessed by call or text. We have staff on 7 days a week, 10 a.m. to 10 p.m. most days. On Saturdays, it's noon to 10 p.m. And so when someone calls, we really only take a little bit of information. We don't want to get bogged down with, a whole lot of reporting or anything. We want the caller to be able to direct the conversation. So when someone calls, we do ask, for their name. They could give us an alias. We ask for the county they live in, their age, and then from there, it's just whatever they're looking for. And it's a one-on-one conversation, but we do have the option and the capacity to have an ongoing peer relationship. So there's all kinds of calls and all kinds of callers. Some people are fine with just one conversation. Some people just want a resource, or they want, help on one particular thing. But other people really benefit from having a regular resource to turn to. So we do have a fair number of regular callers, and it just depends on their needs. Like we've had a young person whose parents reach out and set up recurring Zoom meetings with one of the peers, and that's been really beneficial. So yeah, it's really up to what that person's looking for. That's what at its core peer support is about, letting that person kind of define what they're going through, define what they need, and going from there. And then we also have virtual support groups. We have one every Tuesday at 7 p.m. over Zoom. That's open to anyone LGBTQ 16 and up. That group is really one of the most active parts of the program. It's the last more than a year, it's been steadily attended. There's a core group of people who always are there, and then new people kind of filter in and out. And the same peer specialist is there every week to facilitate. So yeah, that's been really successful. Again, it's virtual, so anyone really can join. And we do have a little bit more age diversity in that group, again, because we're seeing that adults are looking for support too. We have a range of ages in that group, but just 16 and up is generally what we're doing. And then in-person groups happen not as frequently as we would like. It has been hard just with being a small staff, and over the years, different restrictions with the pandemic and stuff, and just different priorities going on. But we do in-person groups, and hopefully we'll have another more regular groups happening. But it also just depends. When people call, if they are in an area where we have a peer specialist and the peer specialist is comfortable coordinating something to meet up with a group of friends, that's something we can do too. We've done some evaluation of Prism over the last couple of years, and we gather feedback from the people who use the program. And it's been really great to get, that direct feedback about what we're doing. So just some quotes here. People have said it's a huge relief to have peer support specialists to talk to when I'm feeling stressed. People have said Prism gives me a meaningful connections and a space to share. It's connected me to resources that I don't think I would have connected to otherwise. And Prism is good at listening to people and accommodating what they want and need. So yeah, again, it's kind of reflecting that people are feeling supported, that it's opening up new resources for them in their recovery. And it's just a relief to talk to people who get it. And there's all kinds of things that are discussed on the warm line. it really ranges, but we do see a lot of conversations about like just gender identity, questioning, exploring, trying out different, terms and expressions. People talk about, their experiences with different kinds of rejection, people not understanding their gender, people deliberately misgendering them. People want to talk about coming out and relationships. We see people talking about just different mental health diagnoses as well as trauma. And substance use comes up often, and goal setting, and really helping people to define for themselves like what self-care is, what social support they have that they can lean on, and what do they need. And that is, again, like this is really driven by the person. And so we're there to help explore those things and to help them kind of find their, find the resources that they already have to lean on, in addition to finding new things to explore. So in summary, there is a really great need for accessible and affirming services to intervene on LGBT health disparities. We need more things like Prism, where LGBT folks can go and be with their community and get the support they need. But also anyone can promote LGBT mental health by creating accepting and affirming spaces at home, in the workplace, and in the community. So this is not something that is just for mental health providers to deal with. It's not just something for Prism to deal with. Anyone has a role to play, and you can make a huge difference wherever you are. And we need more things like Prism. We need more outward support for LGBTQ people to show that they are welcome and that they belong, and that this world is for them too. Okay, that's it. I feel like I talked so much, and we might have we have a lot of time, it looks like, so I'd be happy to take questions.
All right, thank you, Erica. Do our guests online or in person have any questions for Erica? There was a question, is your slides available? Are your slides available so we can add them to the handouts drive?
I can send them. Yeah, I don't mind.
Excellent.
Yeah.
There is information on the Prism program, as well as some of those other mental health support groups, both here in person as well as in the drive as well. That was provided by Erica. And again, I can't stress enough, they are virtual. So please make sure that you're sharing those with your contacts as well.
Yeah, and I will say too, if anyone wants some like physical materials, we have brochures and stickers and business cards to promote Prism. So those are great for resource fairs and stuff like that. So yeah, if you're in the Milwaukee area ever, we would have you pick them up, but we can also ship them. It takes us a little bit of coordination, but we can do it.
Excellent. So in that summary guide, you do have Erica's email and contact information, so you can reach out to her. There was a question from one of our participants. I know you said that you can give an alias when calling Prism. However, if they don't want to give a location or anything like that, can they still get help through it?
Yeah, good question. Yeah, it's okay if they don't want to share location. It's helpful for our reporting and funding purposes to have that, but no, we wouldn't turn someone away if they declined.
What are your go-to resources if somebody, for example, wants to get the definitions that you had mentioned? I know you could search, for definitions, but are there any that you would recommend for people to go to?
Yeah, what a good question. I mean, I'm trying to think. I guess like I'm so used to these things that I don't always pay attention to the other resources that people put out. There is like I know the Trevor Project's website also has a lot of that kind of information. So I would look at that, and I'm trying to think what else. Yeah, that's a good question. That's a good question. That's something I could look into too. I think if there's like just like a one pager or something.
Absolutely, that would be awesome. Are there any other questions from the group?
I have a question.
Yes, ma'am.
You said that you have to report county when you call in, like you have data on rural Wisconsin versus more urban. If you know, you have Madison, Milwaukee, and, but what about like northern Wisconsin, central Wisconsin? How many rural communities members you find calling in?
Did you hear that, Erica?
I'm so sorry I did not. Yeah, if you could repeat it.
Absolutely. So do you have a breakdown of rural versus urban, just based on the number of folks kind of that are utilizing the service? Do they fall outside of the areas that you are working in, specifically like in Milwaukee or Madison and La Crosse?
Okay, yeah, good question. So we do see that we skew more towards those three places, but I'd say it's probably, like, if I had to guess, it's probably like 25% of our contacts are outside those areas. Yeah, and I don't know if that's just because, like, I think like we skew towards those areas where we have staff because those staff are like doing a lot of in-person relationship building. So that's a factor. But yeah, in general, we do see higher, we do actually see higher disproportionate rates of suicide death in rural communities, even compared to urban communities. And we don't necessarily have like census data to break down like LGBT populations in those communities, but they're definitely there. Like our new team member who's in Ashland, who's super cool. They talk about this a lot. Like Ashland is a small place, but there is a thriving queer community. It's just there's people don't often think about it, and there's not a lot of outward resources. So they're out there. But yeah, we do see a skew because of where we are.
Sure.
It's really important to get to those rural populations because we know that there's less resources there.
Trying to get my screens to work here. All right, excellent. Are there any other questions that people have for Erica? I want to make sure we give enough space for people to be able to answer them or ask them. Or is there anybody that's on the webinar today that has programs within their counties or communities that they would like to share with the group? If so, you can feel free to unmute yourselves.
So is the
Karen.
one question I have is, I'm assuming the Prism Program, if someone calls in, is free to them, or, you know, the cost?
Erica, is the Prism program free? Is there a cost? And how is that program supported?
Yeah, no, Prism's totally free. No need for insurance, no need for any of that. Yeah, the program over the years, we've been supported by different grants. So yeah, at the moment we have some grants related to peer support that we're working with. But yeah, no cost for people using it.
Excellent, thank you. Sharon shared an Anigo at Avail, which is their local shelter, that they do have a program specific or offers a safe place for those that are in LGBTQ plus in abuse or sexual assault situations. Thank you, Sharon, for sharing. Okay. Well, if there are any other questions that people have, I'm just going to do a quick wrap up and a reminder. Those of you that are online that are only attending this session or are not able to attend other sessions today, we do have an evaluation that we are asking people to do. You can check indicate the specific sessions that you did attend. Those of you that are in person here in this room, again, we do have those evaluations. You can fill them out for all the sessions at once or individually as well, if you'd like to provide individual feedback to our presenters. Thank you, Erica, again for your time today.
Yeah, thanks for having me.
Thank you. Thank you.